That was really interesting. And so we've heard, my very specific suggestions and thoughts. Ashley had a case, and then you gave us a broad overview of the issues that all your members are facing. And so I'm struck with a few thoughts. One, your comment that it's really hard to have a policy that you can't monitor or enforce because we don't have the tools. They haven't necessarily been invented yet. And I can speak from my perspective at the ALS Association. When we have 160 or 170 or so active projects at any given time, we're thousands of times smaller than NIH. It's really hard for us to develop those tools by ourselves. And even when we work collectively, it's hard to do that too. But I think my overwhelming message from all of this is that there's a number of things that funders can do outside of the policy itself. But we have to remember that the goal of a data sharing policy isn't to share data, it's to advance science. And then for whatever reason, our organization exists. So for NIH, to advance science and health. For me, advance science that's going to lead to the end of ALS and effective cures for everyone. It's a little bit different, but it's that getting to that end goal is what's important. And I'm worried in our way of implementing these things, we're going to focus on a process like collecting DMPs or something and miss the big picture, the real goal. But having said that, you all have identified a number of things. So I had a question for Ashley in that, do you offer, this came through the chat, specific training for your scientists on data sharing in the way that I believe they mentioned Wellcome Trust offers training for early investigators?
Thanks. That's a great question. From my viewpoint, I don't believe that we do. It could depend on program teams. So maybe there's a program team that does specifically train early career researchers. I do think it's something that we could strengthen at the foundation as part of our overall plan to improve. What I have seen done, and this spans early career researchers and others, our agriculture teams have been really intentional about building in fair data from the beginning of their investments. And so they've created, which I think it's pretty close to prime time, but over the last 2 years working with CABI and ODI and different agriculture and open data groups to create basically guidelines, but also it's more of an interactive way to work through what is needed to think about an output management plan. So we're trying to think a little bit bigger around than just, what do we call data? What is data? So output management plan is what we're using at the foundation. And then all the way through, how do you set up your investment? How do you do the data collection? And then through to kind of the publication and the sharing of outputs there. So I'm very excited to see that kind of component wrap up. And I believe it could be scalable to any of the disciplines that we work with. So that's one piece that we do have that's really focused on training and education of it, but nothing that specifically targets early career researchers at this point that I'm aware of.
All right. Well, thank you, Ashley. I know from the ALS space, we had this strange event of an ice bucket challenge, which led to a huge infusion, a one-time infusion of research investment. Some of that was spent on specific data sharing and collaborative research projects, and we were able to track increased collaboration, additional gene discovery and stuff that we probably wouldn't have happened without those specific efforts. But I'm wondering, Mary Rose, if you found in working with your different members that have different disciplines, if a specific investment in sharing in general, not through an individual resource, was able to have an effect of pulling that specific disease space together or getting them to be more productive?
Actually, so we have specific examples of foundations or funders who have done this. And it's a good and a bad example because it was very resource intensive. They put a foundation FTE, one person facilitating the data sharing and making sure the metadata was correct. They had one instance actually had a hackathon. So they required everyone to make their data open, and then during a couple of days, they gave access to everybody in the field. Everybody had access, but they highlighted and publicized that access and said, can you solve some of these questions in neurofibromatosis? And that was huge. They made a lot of progress, but it was a specific instance, a specific case, a very resource intensive, but what certainly demonstrated and to their data or their fundraisers, actually, after this hackathon and after they shared all of the research progress that was made, they got a huge influx of money. And a lot of them was designated towards data sharing in very different words. But we want to do this again. We think it's really important that this organization makes that data open. And back to the point of citizen scientists, because their patients got in there too. Their advocacy groups, the caregivers. So it was very exciting for the community. But again, that was patient data and kind of resource intensive.
Yeah, thank you for that. I think when you're dealing with smaller organizations with involved research participants, some of the conversations that we were having in Kristen's panel change because folks feel by participating in the research is literally their best chance to save their own lives or save the lives of their family. And so the risk-benefit equations about privacy are just incredibly different. And of course, will change over time.
Right. But that hits core as context, transparency, and not as much data security, but certainly transparency and context. You see your data, how well it's being used, and you're transparent with the repository and all the metadata and everything. So that really built trust in that community.
Well, thank you. So I'm not seeing a lot more questions in the chat. Richard had a very thoughtful question, though. In that, have you seen data sharing policies lead to more inclusive research studies, getting more people involved because they can see the impacts of their involvement as a participant? And this would be for Ashley as well. I know you guys work all around the world with lots of different cultures.
You go, Ashley, because
I'm not sure I have a good answer for that. Right. I think we're at very early stages of considering that type of data. So we have a gender equality team that is focused on collecting more disaggregated gender and age data in studies that we are conducting, but it's not enforced yet. And I think we're kind of at a struggle of, how do we collect and protect that data? What does it mean when we have that data and how do we analyze it? But there's been thinking around that if we have more of that kind of viewpoint for the disciplines that we're focused in, then we'll be able to think more about equality and diversity in the work that we do. Which I don't think quite gets to it, but we're starting, yeah.
I think that this was the point earlier. We don't have enough data on data sharing, and we're not actually putting in the infrastructure to collect the data that we need to answer that question even.
Yeah.
And our two data sets are disparate. Who we fund, gender, ethnicity, race, and is totally not even linked to the outcomes of our awardees' research. So we definitely need to work harder on that question. And again, we don't want to penalize anybody for our policies. And that's one of the reasons some of us are very hesitant to jump into something that may have unintended harm on certain communities. It's an excellent question. Too bad we don't have a really good answer.
Yeah. And I think we struggle too. Like we've always tried to, I think, be on the side of collecting the least amount of data necessary to get the work done for, privacy and ethical reasons. But I am, now seeing in as we get further into this ecosystem that we don't have great data and even knowing who a lot of our researchers are or subgrantees are, because we only collect 1 or 2 data points within our grant management system.
So Ashley and Mary Rose, I think we're out of time, but I want to thank you both for sharing your experiences with us. And thank you, Richard, for convening us.
Thanks.